Hello everyone, welcome to Concise Nursing. This is where we make nursing very simple for everybody. Please, if you're new to the channel, subscribe to the channel and also click on the bell so that anytime we upload a video, you will be notified. And also share with your friends so that we can all learn together and make the world a better place for ourselves. Today, before we start, I'll give a scenario. So imagine you are with your spouse going to a party, and then party you're going to enjoy. All of a sudden an accident happens. Your spouse is seriously injured and she's bleeding. You were not injured. What will you do in such a situation? Imagine you're in the house and your small boy starts crying and wallowing on the ground, holding the abdomen. Daddy, my stomach is paining me seriously. What will you do? Imagine your friend just calls you. Charlie, I've been bitten by a snake in the backyard. What do you do in such a situation? So therefore, there's a need for you to know something about first aid so that in emergency situations, you know what to do. So today we are doing first aid. Now quickly, let's look at a brief history about first aid. Now, the use of first aid dates as far back as the 11th century, whereby the knights used to give first aid treatment to the soldiers in the battlefield. Along the line, we didn't hear about first aid again. The name of first aid went into silence, and then later, until the 18th century, where the Battle of Solferino started, that's when first aid came into being again, and then religious societies came together to assist the soldiers in the battlefield. The Red Cross Society was formed, St. John's Ambulance was also formed, and others came into existence. Now, in our modern time, we have a lot of these societies helping with casualties everywhere, on the streets, in the construction sites, and everywhere. Now, as years gone by, development has happened and technology has advanced. A lot of procedures has changed, and techniques, equipment that we use for first aid has also been advanced. All right, so therefore, there's a need for us to also know first aid so that in emergency situations, we know what we can do in our time. All right, so without wasting much time, somebody will ask, what is first aid? All right. First aid is the provision of initial care of an illness or injury, which is usually performed by a non-expert person to a sick or injured casualty until definitive medical treatment can be assessed. What this means is that first aid can be performed by a non-expert, somebody who has not been trained, officially trained in performing of first aid treatment or in giving first aid. So therefore, anybody at all is a first aider. Whenever there's an emergency or there's a situation at hand, just go in and then do your best that you feel is appropriate and is correct to save a life. Okay, now proper early measures may be instrumental in saving life and ensuring a better and more rapid recovery. So the measures you put in place as a first aider will ensure that their lives will be safe or they will die in your hands. Okay, so before an ambulance comes into the scene or before you transport the people or the persons involved in an accident or in any emergency situation to the hospital, the measure that you put in place will ensure that they will recover early or faster, and then they will go back to their lives or not. Certain self-life limiting illnesses or minor injuries may not require further medical care past the first aid intervention. What this means is that there are some certain illnesses that after first aid, they don't need any other professional hands again, being it a surgical case or a medical case. Some medical case can happen so sudden, that's what we call the acute. So in an acute condition, some acute conditions can be handled using first aid, and after first aid, they don't need any professional hands again. That notwithstanding, doesn't mean that first aid takes the place of professional medical treatment. Whatever the case, send the person to the hospital. Then after it's been discussed, the patient is fine. Okay, then we allow patients to go home, or we just patient to the house. All right. It generally consists of a series of simple and, in some cases, potentially life-saving techniques that an individual can be trained to perform with minimal equipment. So, with small training that is given to somebody or a layperson, he can be very equipped with a lot of knowledge and skills to perform first aid. Whilst first aid can also be performed on animals, the term generally refers to the care of human patients. So, in this case, we are looking at human patients, not other animals. All right. Now let's look at the importance of first aid. It is important to know first aid so that you can help yourself or others that may be injured. Okay, so you know first aid to help yourself in case there's an emergency situation and then you are not dead, you are alive, and then there's something you can do to protect your own self. Quickly you do it. All right. So if it's an accident or you're in the house, there's an acute condition that suddenly happens to you, and then you have a knowledge about it. Quickly you can touch yourself and then give yourself a first aid, and then you're okay. And then we are learning it so that we can also deliver same service to other people who may have find themselves in emergency situations. Now, the chances of someone recovering more easily or even surviving an accident or injury can be greatly improved if someone immediately uses first aid knowledge to assist them. Now let's look at aims of first aid. Aims. Now the aims of first aid, one is to save life. One is to save life. So the moment there's an accident or a mass casualty, all right, you quickly go in and then you try and save life. If people are bleeding, try and arrest bleeding. People who need help, people who are shouting, head injury, a lot of different things. So you try as possible and then you save a life, all right, by simple techniques. Now, two, to protect the unconscious patients. Okay, so to protect. An accident happens, people go unconscious. Okay, they can't do anything, they can't see what is happening. So you try and protect them. That is, if it's in the middle of the road, try and control traffic, or you cordon the place, or you carry them from the accidents into a safer ground so that they don't end up dying, or another accident don't end up happening. Now, to prevent further injury. The next aim is to prevent further injury. So in the case of an RTA and then it's in the middle of the road, other ongoing cars can come and run over these patients and then they'll all die. So you try and prevent further accidents or further injury from happening to them by cordoning the place. Also, people who have minor fractures, you can quickly improvise a splint and then you carry them from the scene so that they don't end up dying. Now, to promote recovery means what you do for the patient will determine whether the patient will stay in the hospital for a long time or the patient will be discharged home in the near future as quickly as possible. All right. So the next point you'll talk about is to preserve life. The fourth one is to promote recovery, and then this one is to preserve life. Simply put, if you're alive, okay, you know what to do so that you don't end up in an accident. With the knowledge you have in first aid, you can protect yourself from getting some minor injuries and minor acute illnesses. So preserve your life as quickly as possible. All right. Now let's look at some principles of first aid. Principles. All right. Principles of first aid. One is to assess the scene. Now, assessing the scene means you should assess what is at hand, okay? Assess the place before you go in. You don't just, once an accident happens, and then quickly you're running to go and join. There can be series of accidents happening. Imagine there's an explosion. First explosion can happen, but then subsequently another explosion can happen. So make sure that all these things are done, or series of explosions have all elapsed, and then quickly you can go in at the first aid to give your first aid. So one, by assessing the scene, you make use of the 3 C's. Okay, the 3 C's. So the first C is you check, second one you call, third one you care. Okay, by checking means you check the situation and also the people. So check the situation at hand. Is it safe for you to go in? If it's a wildlife, is the animal that attacked the patient still not around to also attack you? If it's a landslide, are the rocks not still falling? Make sure that you are safe. So check, assess the situation before you go in, and then check the person. Okay, you also check the person that has been affected. You check if the people are bleeding. You check if they can move, or if there's any movement happen, if they can respond to stimuli. Okay, then quickly. The next thing you look at is call. So you call or you activate the EMS, the emergency medical team. That is the ambulance service. So as you give the care, you can let somebody or a bystander make the call for you. Nana, you call 193 or 112, and this is the emergency ambulance number, and then quickly they will come in to come and convey the people to the hospital. Whilst these people are on their way coming, you care for the people. Okay, by care you give the care needed to casualties by using the ABC or the CAB rule. All right, so CAB. Before we were using the ABC. All right, but American Heart Association has come out with the CAB, in the sense that CAB saves lives more than the ABC. What C stands for is circulation, A stands for airway, and then B for breathing. So once you get to the accident scene, people are bleeding. You check if circulation is still in place. Okay, you check the carotid artery. Put your hand in the middle of the throat, and then you tilt it to the side. You can hear a beep or a pulsation. So that is the carotid artery pumping the blood directly from the heart to the upper extremities. Okay, so if that is happening, quickly you can check the airway. If the tongue has not fallen back to block the airway, check the rise and fall of the chest to see the patient is breathing. Okay, if any of this is not available, quickly you start the CPR, that is cardiopulmonary resuscitation. Okay, now, so that is that about the assessing the scene. Point 2, you ensure safety of the casualty and the first aider. Okay, so as I said earlier, you ensure that patients are safe, as well as the nurse or you the first aider, you are also safe, by making sure that if it's in the middle of the road, you carry the people from the road, or you coordinate the place and then you redirect oncoming traffic. So that's about safety. Third point is moving danger from patients. Move danger from casualty, or casualty from danger. Okay, or remove casualty from the danger. So you either carry the people from the road, that is removing the casualties from the danger, or you carry the danger from the casualty, that is by coordinating the place and then directing traffic, so that the cars cannot run over your personnel or your patients you have at hand. Now, provide privacy and confidentiality. Privacy. So privacy, if somebody has a fracture and you want to open the place, make sure you provide some kind of privacy. You don't just naked people in the middle of the road or on an accident scene. Remember, people are there to just observe and then take pictures and go and post. They are not there to help you. So make sure you provide privacy. Even though you want to help, their privacy is also at stake. So provide privacy. And then 5, you try and minimize infection. Minimize infection in the sense that if you want to improvise, let's say somebody is bleeding and then you want to arrest the bleeding, you don't have tourniquet, so you use a clean cloth to tie over the place that is bleeding. Okay, you don't use any dirty cloth. Oh, there's an open fracture. Bone infection is one of the toughest conditions to treat on the world, and it takes time to heal. So if the bones get infected, it means the person is going to be on the ward for a long time. So you try and prevent that. So minimize infection. Okay. And then the 6th one is about the Good Samaritan law. Okay. Good Samaritan law protects you, the rescuer, or the first aider, if not in case of gross negligence or willful misconduct. So the Good Samaritan law is a law, this dates back in the Bible, where the Good Samaritan happened to help somebody that was attacked, armed robbers attacked on the way. All right. So the same thing happens here. If an accident happens or an emergency situation and then you go in to help, this law is what is going to help you. Okay, unless you go and then you misconduct yourself and then gross negligence, you allow people to die, or you just increase their rates, or you do things that will make them die as quickly as possible, that one the law will not back you. Okay, but once you go in to help, every country and then how this law operates. So there are some countries that if you're not a first aider and some accident happens, you don't need to venture to the scene. Okay. And then there are some countries that even if you're not a first aider, you don't have any knowledge about first aid, you can quickly go in and then go and assist the people. So that's about the Good Samaritan law. And then your treatment should be current and up to date. So just like I said, they use a CAB instead of ABC. So technology is advancing and then updates keep coming. So as a first aider, always try and update yourself so that you don't use old methods in caring for your patients. Now, role of the first aider. The first aider deals with the whole situation. That's the injured person and the injury or illness. So when you go into an accident scene, you're going to take care of the injury that person has sustained. Person might have head injury, can have fractures, multiple fractures. Okay, person can be bleeding. All right. So there are different things that can happen at the accident scene. You take care of those conditions or those things at stake, and then you take care of the person, ensuring that the person does not die. Okay. And the first aider should know what to do and what not to do. So you should know your limits. You should know that some things that are advanced techniques. Don't use it as a first aider. All right. Unless the experts come in. And the first aider knows that his first aid knowledge and skill can mean life or death, temporary or permanent disability, and rapid recovery or long hospitalization of the casualty. So what you're doing to the patient can either determine whether the patient will be on the ward for a long time or for a short time, or even at the scene, his life and his death all depends on you. So whatever you do for the patient, make sure you have this in mind. Ensure that casualty is kept alive until expert helps arrives or is sought by respecting the CAB rule. So make sure persons do not die. The moment you realize that circulation has ceased, let's commence CPR. Okay, all right. So note, if in every emergency situation, identify yourself as a first aider and offer help. So don't wait for somebody to give you a formal education about first aid before you can practice first aid. Once there's an accident or there's an emergency and you know you can help, you have a little knowledge that you can help, quickly go in and go and help. Assess the situation at the site and determine quickly what assistance you can give without endangering life. As simple as that. You assess or you diagnose the condition or of the injured person or the sick person. So this is done in the hospital, whereby doctors will come in and then they will have to determine what is actually wrong with the person and then quickly will tackle it. Okay. Establish priorities for care and give appropriate urgent first aid, bearing in mind that a casualty can have more than one injury. So what I said over here, person can have more than one injury, head injury, bleeding, fractures. Okay, so all these things can happen. So make sure that you tackle it and then you tackle the most urgent one on the same person that you are trying to save their life, the most urgent one before the later ones can happen. Okay, so arrange for medical aid according to the degree of illness or injury. So activate the EMS and then ambulance will come in and carry this people. Now let's look at the major techniques that you use in first aid. Major techniques. Major techniques used in first aid. The first one is A, standing for airway. So you try and clear the airway. If it's blocked by the tongue or the teeth or something, just try and remove it. That is the A. B is the breathing. You check if patient is breathing, check the rise and fall of the chest. If patient is breathing, patient is not breathing, quickly you can start with the mouth-to-mouth respiration or by the use of an ambu bag. Okay, so you look for chest movement up and down. You listen to the breath sounds, how deep the sound is or how shallow the sound is will determine if patient is getting enough oxygen or not. Okay, and then you can feel if air is coming out of the nostril of the patient by sending your hand closer to the nostrils. Okay, all right. So C is for circulation. You check circulation by checking on the carotid artery over here. Check the carotid artery. If there's pulsation, it means blood is flowing. If there's no pulsation, it means the heart has stopped working. And quickly, you need to commence CPR to ensure that you kick the heart into action again. So that is C. Now D. D is you check out for deformities. So deformities, you check out if there's a broken limb or something, if the leg is lying straight and then there's a deformity, quickly you can just see it. Okay, there's no joint there, but it's curved like that. If it's in the arm, you can quickly see that place that there's no joint and then it's crooked or something. So look out for these deformities. And then after you see these deformities, if it's an exposed or open fracture, quickly you can expose that area. You can expose the area and then you arrest the bleeding, or you try and reduce the fracture quickly as possible. And then you splint so that you don't dislodge the bones. All right, so these are the major techniques we use. A for airway, B for breathing, C for circulation, D for deformities, E, you expose the area and then arrest bleeding. Now, act as a first aid, act quickly, quietly, and methodically, giving priority to the urgent condition, that is triaging. Okay, so when in a mass casualty situation, you try and tackle the most urgent ones before the later ones can come in. Okay, so as quickly as possible, remove the casualty from the accident scene. Okay, so you triage them according to the degree of injury, and then quickly you evacuate them to the hospital. Now ensure that there is no further damage to the casualty, yourself as well as the bystanders. So make sure that if it's an explosion, you try, as a first aider, you try and prevent people from running to go and fall in the explosion, because perhaps they don't have a knowledge that once an explosion happens, there can be later ones happening. Okay, even the later one can be more dangerous than the first one. So you try and prevent people from going there. You yourself prevent yourself from going there. After everything has occurred, then quickly you can go in and then you give the help that you feel you can give. Now, avoid unnecessary movements and over-excitation of victim to prevent further injury. So avoid moving patients too much. Probably accident happens on the road and you want to carry them from the scene. Different idea comes and then, no, let's carry them to this place. No, let's carry them to this place. And before you realize, you are overstressing the people. Okay, so prevent that. Take right decisions and act upon it, and then let patients be fine as quickly as possible before the experts come in. If breathing has stopped or is failing, clear the airway, and if necessary, start emergency resuscitation. That's CPR. You control bleeding or you arrest bleeding. If there's any part of the body that's bleeding, you can see a vessel is out and the blood is oozing out, quickly arrest it by tying it with a tough tourniquet. Assess level of consciousness by the use of the GCS. We have what we call the GCS, and we have what we call the AVPU. So the GCS is actually a tool or a technique that we use to assess the mental status of a casualty at an accident scene. So probably a person has had a head injury, so you assess this one. This one has three forms. We have the eye opening to best verbal stimuli, and also the best motor response. Okay, so is the person able to open the eye upon mentioning the name or pinching the person or doing something? Best verbal stimulus, the person able to talk or express himself, showing that the person is still alive. Is the best motor response, the person able to move any part of the limb or the whole body or something. Okay, so that is what we use the GCS for. And then the AVPU, A standing for alert, the V for verbal response, P for painful stimuli. Is the person able to respond to pain, and then U for unresponsive. So patient is not able to respond to anything you do. So A for alert is the person alert. So you go, the person's lying down, wow, with the eye opened. Best verbal. V is for verbal. Is the person able to talk, tell you what is happening, or please help me, shouting and all that. Painful stimuli, if pin the person is lying down, not doing anything, you pin the person able to respond to pain, and the person has no response. Okay, that's unresponsive. So the GCS and then AVPU. Now give reassurance as necessary to the casualty and to those around to lessen anxiety. So people around, probably people have their relatives inside, so you try and calm them down. Please, they'll be fine. Please, the help is coming. Ambulance is on the way coming. We will attend to all of them and then they'll be fine. Please relax. So you try and give reassurance to the bystanders and then the casualties themselves. Now position casualty correctly. So you have different forms of positioning, i.e. supine position, prone position, recovery position, and all that. So depending on what has happened to the person and the position that you give to the person, later we will look at those positions. All right. Now immobilize fracture, if any, before moving casualty. So if there's any fracture, try and immobilize by splinting. Okay, so you might not get the actual tool for splinting, so you try and you improvise with a hard something, try and put it, and then you bandage around it to splint it, make it firm so that the person can be transported. Otherwise, you will dislodge the bones the more. Okay. Avoid overcrowding around and allow fresh air. So people have surrounded so much, you try and tell them to go back so that fresh air can come in, and then the people can get oxygen to breathe, and then they'll be fine. Do not attempt too much. So if something has happened and you want to attempt, probably you want to give an IV line, you attempt one, you don't get two, you don't get, please stop, let the experts come in. Or you want to intubate, you try once, two, you are not able to get it, please stop and let the experts come in. So do not attempt any procedure too much. All right. Do not remove clothing unnecessary. So don't naked patients. That is why not we talk about the privacy. So don't naked them and then unnecessarily. Okay, but if there's the need, try and provide privacy, and then you do the necessary thing for them. Observe and record any changes in condition of casualty. This is in the hospital. So if there are changes happening to the person, you try and record it in their folder or on their sheets. Now, do not give anything by mouth, that's NPO, no per house, to casualty who is unconscious. So somebody who is unconscious, you don't give anything by mouth. You might end up going into the lungs rather than going into the abdomen or going into the stomach. So if anything or any medication you want to give a person, it should be parenteral through the skin. All right. The following are some conditions that require immediate attention. Okay, something like asphyxia, that is cessation of breathing. The person is not breathing. It's a serious emergency. Severe bleeding. Okay, patient blood vessel is out and blood is oozing out. Person can easily pass out or die. Poisoning can easily kill. Stroke, heart attack, asthma attack. All these are serious emergencies. So if it happens quickly, as a first aider, you go in and then you give your expert or the needed help you feel you can give as quickly as possible. Now, the essentials of first aid treatment include the effective methods of cardiopulmonary resuscitation, that's CPR, and artificial respiration, correct bandaging of wounds, correct application of splints for fractures and dislocations, appropriate treatment of shock, fainting, bite, stings. Okay, so we will look at all these things I've mentioned, okay, all these conditions that I've mentioned. We'll look at them one after the other, and then the first aid treatment that you need to give as a first aider. All right, so that is about first aid. This is where we end today's video. If it helped you, please subscribe and then share to your friends so that we can all learn together. Once again, this is Concise Nursing, and then thank you for paying attention. Remember, wherever you find yourself, you are a first aider. Goodbye.